Hello doctors, welcome back to Jabstudiesmetfun. I'm Dr. Aishwarya Mukal and this is your first part for ophthalmology must-know images. So let's get to it. The external appearance of eye, normally not asked in the exam but you should know it for your own information. Lacrimal apparatus, however, can be asked. Most importantly, the different important landmarks of lacrimal apparatus, that is lacrimal canaliculi, the lacrimal sac, nasolacrimal duct, and most importantly the lacrimal gland. So we will get to the different kinds of disorders that come into ophthalmology. The first one is heterochromia of iris. It is seen in congenital Horner syndrome. Subluxation of lens. It is an important question. It is seen in Marfan syndrome. Which is this is a one-liner question straight up asked in the exam. Membranous conjunctivitis. It is growth of true membranes into the conjunctival epithelium as compared to pseudomembranous conjunctivitis, in which only a layer of debris and inflammation accumulates atop the conjunctiva. You can see that the membranes of the eye have been growing into the conjunctival epithelium, and that is what causes irritation. That is membranous conjunctivitis. Angular conjunctivitis. It is infection by Moraxella axenfeld. Important. And the treatment is 1% tetracycline and zinc oxide. Subconjunctival hemorrhage. It is the most common cause is blunt trauma to the eye or the orbit. You can see there is redness in the eye, which looks like some arteries have been burst. So basically, the conjunctiva, the arteries beneath the conjunctiva, they will hemorrhage, and that is your subconjunctival hemorrhage. Symblepharon. It is an adhesion between bulbar and palpebral conjunctiva. The different disorders related to eyelid. The first one is trichiasis. It is the inward turning or misdirection of eyelashes causing irritation to conjunctiva. We can see that the eyelashes here, which should be outward, are instead directed inward, which will cause rubbing against the conjunctiva, and it can cause irritation. Extra row of eyelashes. This is a normal row of eyelashes, and you can see that small hair, that is an extra row of eyelashes, has grown over here, which can also cause irritation. That is your distichiasis. Madarosis is an absence of eyelashes. Stye or hordeolum. It is acute painful inflammation of the Z's and mole glands. Mostly it is caused by Staph aureus. Chalazion is a chronic painless inflammation of meibomian glands. Incision and curettage done for chalazion. It is the treatment of choice, and you use a chalazion clamp for it. You can see that the eyelid has been outwardly turned, and a chalazion clamp is used to isolate the chalazion and to remove it. Ankyloblepharon. It is an adhesion between two eyelids. Entropion is the interning of lid margin. You can see that this is an interning of the lid margin. However, ectropion is outward rolling of the lid margin. Trachoma. Trachoma mostly takes place on upper eyelids. It is caused by chlamydia trachomatis. Blindness caused by trachoma is irreversible. Please remember that. It is irreversible blindness. It almost always affects both eyes, and symptoms begin with mild irritation, itching, eye discharge, redness, and progress to blurred vision and eye pain. So, what are Art's line? Art's line are caused by conjunctival scarring in trachoma. You can see that this is the Art's line. Herbert's spit is another pathognomonic lesion for trachoma. These are black dots over here. You can see these in sclera. These are also pathognomonic for trachoma. Ophthalmia neonatorum. It is the most common cause is chlamydia trachomatis. Again, vernal keratoconjunctivis. There is a huge confusion between trachoma and vernal keratoconjunctivitis. So in vernal keratoconjunctivitis, there is cobblestone papillae, which is a differentiating feature from trachoma. Horner Tranda spots. These are also seen in vernal keratoconjunctivitis. These are eosinophil accumulation inclusions over here like this. Please don't confuse them with Herber's pits. Herber's pits are darker in color and Horner-Tranta spots are lighter in color, and they are due to eosinophilic accumulation. A shield ulcer can also be seen in VKC, which looks like this. Arcus senilis, also known as gerontoxon, which is lipid accumulation in old age. Over here, it looks like a cataract ring, which is basically lipid accumulation in the cornea. Pterygium, most commonly nasal or medial, on the medial side. On the medial side, like towards the sides of the nose. Flyctenular conjunctivitis. It is most commonly due to Staph aureus, and it is a type 4 sensitivity reaction. Cataract, the different kinds of cataract that can be asked in the exam. First one is congenital cataract, which famously known as ophthalmos. It is large hazy cornea with Habs striae. Habs striae is important. They might not give you the image most of the times. They will only give you for example, they will give you a case of a neonate that has Habs striae. The answer straight up tells ophthalmos. Congenital cataract, which shows leukocoria. It can also be seen in retinoblastoma. Leukocoria is this white colored illumination of the eye is leukocoria. Onion peel appearance, which is seen in posterior polar cataract. You can see that the cataract looks like an onion peel or the rings of the onion. Sunflower cataract, it is associated with Wilson's disease. In Wilson's disease, there is basically an increase in copper levels in the body. Oil drop cataract, it is associated with galactosemia. It is the accumulation of galactitol in the lens. It is also reversible cataract. As you reverse galactosemia, this cataract can be reversed as well. Rosette cataract, recently asked in at least 2 to 3 past exams. It is also known as traumatic cataract, characteristically due to blunt trauma. Snowflake cataract is seen in diabetes mellitus. It is mostly seen in diabetes mellitus type 1 more than DM type 2. It is an accumulation of sorbitol on the lens. It looks like a snowflake. Now, different kinds of ocular infections and the images related to them. The first one is viral keratitis, which shows a dendritic ulcer. A very, very important image for your exam. These ulcers look like they have dendrites. It literally looks like they have multiple branches. So this is viral keratitis. Fungal corneal ulcer. It is a dry, feathery margin ulcer which is which has fixed unsterile hypopyon and a satellite ring. You can see that there is a satellite ring, whereas this is the ulcer. Acanthamoeba keratitis. Firstly, we will look at what the Acanthamoeba bacteria looks like. So it looks like it is they only have a cyst, and the cyst is double walled, and the walls have different. It has a wavy structure. The most common cause that is related to this keratitis is contact lens usage, and one hint that can be given in the exam is history of swimming. The treatment is biguanides or chlorhexidine. In severe cases, penetration keratoplasty has to be done. So that's it for the first video of ophthalmoscopy images. Thank you so much.